So it has two ends on the side, upper end, lower end, and in between them we have the shaft. So upper end is a little bit like expanded, wide, and has got like projections. We call them as condyles. Lower end also is a little bit projected, and it is projected on a side which is on one side. Other side is blunt, do not have any projections. And in between the shaft we have some borders, we have some surfaces. So we take one side at a time and then just like describe about the general feature, then we talk about the muscle attachments which is related to it. So this particular upper end have got like features. This particular upper end has got like these projections. We call them as condyles. We call them as tibial condyles. There are two condyles are there. One is on the medial side, one is on the lateral side. So they are called as medial condyle and lateral condyle. In front of this condyle and anteriorly, we have a bony projections. We call them as tuberosity. Is related to the tibia. We call them as tibial tuberosity. Now on this particular tibia condyles, it has kind of surfaces. There are two condyles which is on the medial and lateral. We are going to identify which is medial, which is lateral later on. In between this particular condyles, we have some space. We call them as intercondylar area, which is present in here, like in between these two semicircular spaces. And within this, we have some kind of bony projections. So we call them as intercondylar eminences. They are anterior, posterior. There are two kind of eminences are there, which splitting this condylar area, anterior and posterior parts. Now apart from that, it has some kind of grooves and the facets which is present on it. So lateral side, it has kind of like a facet which is known as this attachment for this iliotibial tract, and medial side it has a facet for the attachments of this semimembranosus muscle. So these are the two things which is present on it. So we are going to see this particular lateral attachment, medial attachment later on, just like talking about the features. Then talking about this particular shaft, which is like a triangular in shape, it has got like three borders and three surfaces. So this is placed on the anterior side, we call them as anterior border. Other one is on this opposite side to it, we call them as interosseous border. And then we have this one medial border, which is relatively smooth. And it has got like a surfaces which is present on it, lateral surface which is present on this side. This is like a medial surface which is present on this particular medial side, and the back side we have the posterior surface. So three borders and three surfaces it has in it. Now lower end, which is like having some kind of features, one of this particular feature which is having this particular lower end have got like a part of this particular bone which is projected downwards. We call them as malleolus. So this particular malleolus which is present, we call them as medial side present, we call them as medial malleolus. So this is a projected downward part, we call them as malleolus. This is present always in the medial side, that's why we call them as medial malleolus. Now it has got like a medial malleolus, under to it we have the kind of surface which is present to it, under surface, which is like making this particular knee joint surface, ankle joint surface, making this particular ankle joint, or making this inferior surface which is present. Now about the side determinations, whenever you are going to make this particular bone as identifying which side and right side, left side identification part. So we have to identify upper end and lower end first. Upper end, this is upper end expanded, and lower end which is a little bit taper, have got features. Then you have to identify this medial and lateral. Medial and lateral is identified based on these particular projections on this side, which is known as medial malleolus. So medial malleolus is on the medial side. Now once you have identified the medial malleolus, the opposite side will be lateral side. This side will be opposite to it, the lateral side. This is the medial side. And then you have to identify the anterior and posterior. Posterior anterior identified by this anterior border which is sharp. This anterior border is also known as shin, S-H-I-N, shin. This can be felt subcutaneous border in the front of this particular leg. We have this anterior border which is sharp having, and which is ending or starting from this particular tuberosity, we call them as tibial tuberosity. So to summarize this about the identification point, upper end and lower end identified based on these condyles. Condyles above, and this one will be lower end will be placed on back side. Medial and lateral based is identified on this particular side which is known as medial malleolus. Medial malleolus will be placed on medial side. Then we have to identify anterior and posterior. Anterior and posterior is identified by these two landmarks. One is anterior border and this tuberosity which is present on the anterior side, which is present on this region, we call them as tibial tuberosity. So, this particular bone, once you have identified featuring or taking all these particular feature, upper end, lower end, medial and lateral, then we have to identify which side is belong. So, this particular tibia, this is the medial side, we have to place it on the medial side, this is above, this is below, this is anterior and this is posterior. So, this is fitting with the side which is belonging to the left side of the individual. So, this is a left tibia, that is what you have to hold it in a left arm or left hand whenever you are saying it. You have to hold it in vertical position whenever this particular bone you are holding it, you have to just like take it like in a little bit in a vertical position is good enough. So, identification point is like this, you have to identify it based on these particular features, anterior, posterior, above, below and medial, lateral, right. Then once you have identified, again we are going to talk about the features which is present on this particular bone on the upper side. So, in the upper side these have two are condyles, one is condyle when present on the medial side, we will going to call it medial condyle. Other one is present on the lateral side, we call them as lateral condyles. So, this is a medial condyle and lateral condyle. If you look at the size of it, medial one is a little bit broader and larger compared to the left side. It has a significance in the joint movement about having one thing which is broader and bigger than that of other side. And these are the bony parts which is present in here, we call them as eminence, intercondylar eminence, which is present in between this particular condyle. So, in between the condyles, this particular bony tissue which is present, we call them as intercondylar space or intercondylar areas. Now, anterior to this particular condyle, we have this particular projections which is known as tibial tuberosity. Now, once you have identified this, anteriorly on the lateral side or in front of the lateral condyle, we find a facet. So, this facet is for the attachments of the iliotibial tract, also known as IT band. So, you have to know about this IT tract, iliotibial tract. If you have done the dissections in the thigh region, you have to learn this particular IT band. So, you have to know about this iliotibial tract, IT band or iliotibial tract. So, it is a kind of modified deep fascia of the thigh region which attaches to it. So, this particular facet anterior to this particular tuberosity of this condyles on this lateral side, we have this particular facet for the IT band attachment. This is what you have to know. Then on the underside to it, on the lateral condyle to it under surface of this particular side, you will see there is another facet. This particular facet is for the attachments of this fibula. So, this fibula attachment point or fibular joint which is making out here with this tibia which is present on here, we call them as fibular facet which is present on the underside of it, lateral side. Now, coming on this particular medial condyle, on this particular medial condyle, this particular posterior side of it, you find a groove in here. This particular groove for the attachments of a muscle, we call them as semimembranosus. So, these particular features they are present, attachments of the IT band, also known as this iliotibial tract, fibular bone attachment point which is known as fibular facet, and this particular region have got like a condyles and the tuberosity that is present on the features on this particular upper end of this particular bone. So, upper end once again have got condyles, two of them, medial and lateral, based on the right side and left side or medial side and left side, medial side. In between the condyle space, we call them as intercondylar area which has got like eminence, we call them as intercondylar eminence, which is splitting this particular condylar area into anterior and posterior parts. If you go to this particular lateral condyle, on the anterior to the lateral condyle, we have a facet, we have the attachments of this facet here with this IT band or iliotibial tract lying on it. Little bit on the lateral side, a little bit on the posterior margins, we have this particular facet for the bony attachments of the head of the fibula, which you can see that how this particular fibula is anchored or attached to this particular sides of this bone. Now, to moving to this particular side, medial side, on this posterior side of this medial condyle, we have a groove on the back side laterally or posterior laterally, you can figure out this particular groove is groove for a muscle attachments, we call them as semimembranosus, which is a group of the hamstring muscle which is anchoring to it. So, these are the features which you have to figure out in this particular regions. Now, coming from this particular upper end, we are going to talk about the shaft. Shaft have got like borders, as I am saying, this anterior border which is sharp and pointy, which is starting from this particular tuberosity, which is present on here, which is having a tibial tuberosity going down. So this is, we call them as anterior border. On the side opposite to it, this particular, below this particular facet for the tibia, then we have the sharp border as well, which is present on here. We call them as interosseous border. So we have this particular anterior border, which is known as anterior or shin, that you have to identify, and this particular laterally. Below this particular facet for this fibula, we have this particular interosseous border, also known as lateral border. And opposite to this particular interosseous, we have another border, we call them as medial border, that is like a smoother, which is not that very prominent, starting from this particular medial malleolus, so climbing above and ending towards this particular upper end of this particular medial condyles. So these are the three borders that is present: anterior border, interosseous border and medial border, three of them. And if we have these three borders, we get this particular three surfaces. Between this particular lateral border and medial border, we have this surface which is present on the back side, we call them as posterior surface. So surface coming over here, we have this particular surface which is prominent one, which is known as posterior surface, which is really prominent, which is present on the back side. Entire thing which is having in the back side of this tibia, we call them as posterior surface. Easy to identify, posterior to this particular tibial tuberosity, we have this surface, entire thing which is known as posterior surface. Then we have this particular medial surface and the lateral surface. So medial surface which is present on this particular side, or also known as anteromedial surface. Between this particular medial border and anterior border, we have a surface, we call them as medial surface or anteromedial surface. So there another surface which is under to this particular medial malleolus, which is present on it. So this particular surface we call them as medial surface, which is present on it. And opposite to it, we have this particular interosseous border or interosseous surface or lateral surface, which has got attachments of this tibia, or which has got attachment of the fibula on that particular side. So again, if you just like corroborating this particular articulated thing together, this is the tibia and this is the fibula. This belongs to this particular side, we can identify based on this particular attachments point: anterior, posterior, medial, lateral. So this is a medial side and this is lateral side. This particular thing belongs to the left side of the foot, which this particular bone as well belongs to as well. So this particular element, we have this particular border, anterior border. This is present in here. This border which is present to the fibula side, we call them as the interosseous border, and this is one which is known as the medial border. Then we have the surfaces which is present on it. So this particular surface we call them as medial surface, which is present on this side. This is it. And the posterior surface, which is this side it has, and this surface we call them as lateral surface, also known as interosseous surface. Now about these particular surfaces, little bit about the surfaces that you have to know. Now first remarkable thing, we will talk about this particular posterior surface, which is very prominent out here on this side. On the posterior surface, you will find this particular region, tibia, in this particular condyles. If you consider this, if this is a posterior surface, you are seeing here, you will be seeing a rough line like this. This particular line we call them a soleal line or soleal ridge. This particular soleal line splits this particular posterior surface of the tibia above and below, and then below also vertically can be divided into two parts, medial and lateral likewise. So this particular region above this particular soleal line, SL, I am indicating it with the soleal line, we have this surface we call them as popliteal surface, pop, and here we have this attachments of this particular muscle which is known as popliteus muscle, and on the soleal line we have a muscle we attach to here which call them as soleus. So these two things you have to identify in this particular posterior surface first. So given on this particular bone, you identify the posterior surface, then you identify the oblique ridge which is quite prominent. So this is the soleal line which you are seeing here. Above this region we call them as popliteal surface, where you have the attachment of the popliteus muscle. Then on this undersurface to this particular soleal line, we have this particular space can be divided into two particular regions like medial and lateral by a vertical line which is ending on, which splits it again medial and lateral sides. So this particular element, as you are seeing here, easily can be identified by this particular presence of the soleal line above and below the soleal line, and again vertically can be divided into medial side and the lateral sides. That is it about this posterior surface. Coming to this particular anterior surface, also known medial surface, also known as anteromedial surface, which is on the sides of this particular tibial tuberosity. On this particular region, on the tibial tuberosity, this side we have the roughness on the upper part is present. on it. So, next to this particular tuberosity you will find some roughness there. So, in this particular roughness we have some muscle attached which is present on this particular region. We are going to talk about this particular muscles which is present on it. So, this particular surfaces, two of these particular surfaces is important to us. Then moving to this particular interosseous surface, or which is known as the lateral surface, where this particular interosseous membrane is existing on it. So, this particular region between this particular tibia and the fibula, all the length throughout it excepting some of the natural gaps which are present to it, is bridged by some kind of membrane which is known as the interosseous membrane. So, this particular interosseous membrane makes a kind of joint, that particular joint we call them as syndesmosis. So, you prepare a short note on this particular syndesmosis. So, what do you mean by the syndesmosis, and what are the places we are going to find this particular syndesmosis? Syndesmosis is a broader term. This particular joint which is present between this particular interosseous border of the tibia and interosseous border of this particular fibula, making a joint, we call them as tibiofibular joint. So, there are three sets of tibiofibular joints are there: superior, middle and inferior. So, we call them as upper, middle and lower tibiofibular joint. So, this particular middle part of this particular tibiofibular joint is membranous. This particular membranous part of this tibiofibular joint is also known as syndesmosis, is a kind of joint for fibrous joint. So, you prepare this particular syndesmosis as short notes for general anatomical questions. Now, this particular region, upper end, which is articulating with the head of this particular fibula, making a superior tibiofibular joint, and lower end which is articulating in the lower part of this particular region, we call them as inferior or lower tibiofibular joints. So, these are the joints which are present on this particular lateral side, which is kind of point of interest for us. Now, coming about this particular surface feature which is present on this particular region over this particular medial surface. So, on the medial surface, where we see this particular roughness present on the upper third or upper part of this region, have got some muscles attached to it. So, we have a muscle which is known as sartorius. Then we have this gracilis, and we have a muscle we call them as semitendinosus. So, these are the muscles which are coming from three different quadrants of this particular thigh regions. We have a muscle which is coming from the anterior part of the thigh, medial part of the thigh and posterior part of the thigh, merging together and ending on this particular regions of this particular medial surface or upper part of this particular medial surface of this tibia bone. So, we have a attachments like a hockey stick like attachments or insertion of the sartorius. Then we have the gracilis and semitendinosus which is ending on this particular medial surface. So, this medial surface three muscles which are present on here, that you have to remember here, or you have to memorize it really well. Apart from that, we have to know about this particular posterior surface which has a muscle attached on the posterior surface, is known as popliteus, which also attached to this particular posterior end of the tibia femur as well. You learn about it. Under to it, we have this particular soleus which is present to it, and below this particular soleus we have a muscle which is attached to this particular point. We call them as tibialis posterior and flexor digitorum profundus. So, we have this particular muscle, medial and lateral we have to mention. So, if you have this particular medial side, you have to mention it, and lateral side you have to mention. So, this is, if it is medial side, medial malleolus will be there. So, this medial malleolus which splits this particular space under this particular soleal line into medial half and lateral half by this particular vertical ridge. So, this particular medial side we have a muscle which is present in here, is known as flexor digitorum profundus, and on lateral side we have a muscle we call them as tibialis posterior. উল্টো বললাম কি? Flexor digitorum longus. longus. Flexor digitorum longus and tibialis posterior, which is attached on the lateral side of it. So, these two muscles are there, which is present or kind of like anchored to this particular lower part of this particular posterior surface. So, three muscles we have to remember: popliteus, soleus and flexor digitorum longus, and this tibialis posterior, which is present on this particular lower half on the posterior surface. Coming to this particular muscle, which is present on this particular medial side, which is present on this region as you have this particular sartorius, gracilis and lower part of this particular shaft, lower middle third and this region, we have another muscle which is known as tibialis anterior. So, we have this tibialis anterior that need to be memorized as well on this particular surface as well, whenever you are talking about this particular muscle attachment on this particular medial surface of this particular bone. So, once again, to summarize about this particular muscle attachments on this particular bone which is present on it. So, this particular bone have got like few muscle attached to it. So, notably this posterior side have got muscle attached. So, the soleal line which is present on the posterior side, where it gives attachment of the soleus muscle. Above the soleal line we have a muscle, we call them as popliteus. Below here we have a vertical ridge which splits this particular thing into medial side and lateral side, and on this particular medial side we have this flexor digitorum longus which is going for this particular all the digits in the long muscle, and on the lateral side which has a muscle which is known as tibialis posterior. These are the few muscles that is present on the posterior side that you have to remember. Interosseous side or interosseous surface have got membrane attached to it. So, this particular membrane which is present in here, we call them as syndesmosis or interosseous membrane running on this particular entire length. And this particular medial side above in the upper part of this particular shaft have got muscle attached here. Here we have this sartorius, then we have gracilis and the semitendinosus. Below in the entire length we have this particular muscle, we call them as tibialis anterior. So, these are the 3 and 2 muscles which are important to us to mention over here, and on this particular upper end we have this above, we have a groove for the semimembranosus which is present in here. So, on this side medial side we have this 1 and 3 and 1 again. So, 1 3 1, this ratio we have to keep in mind about here. Semimembranosus on the groove here, then sartorius, gracilis and the semitendinosus, then we have the muscle which is present in here is known as tibialis anterior. Medial side, lateral side, we have this particular interosseous border or interosseous membrane. Into that particular region we have this particular membrane attached to it. So, this is about this particular muscle attached and general features about it. So, let us talk about some kind of important ligaments which is present or under to it, which is anchored to this particular region. So, there are 2 ligaments I would like to mention out here related to this particular bone that you have to remember over here. One is anchored to this particular region, we call them as tibial tuberosity. So, this particular thing is just kind of like a must know, and you must be able to feel this particular tibial tuberosity on your own. In front of this particular region you can feel this particular tibial tuberosity. Into this particular tibial tuberosity we have this particular rough part and the smooth part. We have a bursa intervening here, have got a thick tendon ending in here. So, we have this tendon which is coming from this muscle, we call them as quadriceps femoris. So, we have these 4 muscles of this region which is known as vastus lateralis, medialis and intermedius and rectus femoris. They are merging together making a tendon which we call them as quadriceps tendon. That particular quadriceps tendon anchors beyond this particular patella to this particular tibial tuberosity. We call them as ligamentum patelli. So, this particular ligamentum patelli is anchored to this particular tibial tuberosity, that you have to keep in mind. If you just like identify this particular tibial tuberosity, you can feel this particular anterior ligament to it which is to it related to it, which is known as ligamentum patelli or patellar ligament. So, under this particular patella it is present in here. So, this particular bone is patella. Into here all these quadriceps tendons are ending, and beyond this particular inferior end of this patella, which is known as apex of the patella, this particular thing as it is hanging down, this is known as the ligamentum patelli kind of thing, which is anchoring to this particular bony part which is known as tibial tuberosity. So, this white sheet of this thin plate which you are seeing here, likewise imagine like this is a tendon kind of thing, we call them as ligamentum patelli, patellar ligament. You should be able to feel this particular ligamentum patelli on yourself, like on on your leg in front of here, you should be able to feel this particular bony point, and above this bony point you can feel this particular thing, and if you press it or if you strike it, it creates a kind of reflex action that you are going to elicit in knee jerk reflex in the physiology classes as well. So, it is a kind of like a must know, must learn lesion about here. So, this ligamentum patelli or patellar ligament, what do you mean by this and how does it comes out? This is an exam short note. So, this is ligamentum patelli or quadriceps tendon, or what makes this quadriceps tendon or extensor retinaculum of the knee joint. These are your exam questions. So, you have to prepare this particular thing with the clinical importance to this particular element. Other than this, we have these two ligaments which is present to this particular bone, which are important to us. We call them as medial collateral ligament and lateral collateral ligament. So, there are another ligament which is related to it. We call them as MCL and LCL. So, on this medial side and this lateral side, we have this particular medial and lateral collateral ligament out here is present. So, this particular medial collateral ligament, which is important for us, is that this particular medial collateral ligament, which is anchored to this particular medial tuberosity and medial condyle, and anchoring to this particular sides of this particular cartilage which is present on this particular region. We are going to talk about this particular cartilage in brief about this particular presence. So, this particular medial collateral ligament is present or blending on the sides of this particular condyles of this particular tibia. Likewise, this lateral collateral ligament is present on the lateral side, ending on this particular tip of this particular fibula or head of this particular fibula. So, there are two ligaments which is present in here on the sides here. We call them as medial and lateral collateral ligaments, which is present by the sides of it. So, these are the two things that you have to keep in mind related to this particular ligaments along with this particular ligaments which is present in it. Tibial tuberosity and the ligament attached on the tibial tuberosity, condyles and condylar ligament, which is known as medial collateral ligament and lateral collateral ligament. They are kind of like the ligament for the knee joint. Apart from that, we have two other ligaments, we call them as cruciate ligaments. So, cruciate ligament. They are ligaments which are binding to this particular knee joint. They cross each other and they are present on these intercondylar grooves. So, what is intercondylar groove? This particular region we have this intercondylar groove. An intercondylar groove which is present between this particular condyles. So, intercondylar groove is this middle space between these two condyles. So, this particular intercondylar groove which is middle space is split into two parts by the eminence, anterior part and the posterior part. So, anterior and posterior to it, there is an anchorage of two ligaments. We call them as cruciate ligament. We call them as cruciate ligament. They cross each other. We call them as cruciate ligament. In short, we call them as anterior cruciate ligament ACL and posterior cruciate ligament PCL. C stands for cruciate. So, this particular cruciate ligaments, they are kind of binding ligament for this particular knee joint. They are present on the anterior side and the posterior side of the intercondylar region and related to this particular femur bone condyles as well. So, they are holding this. When you are going to learn this particular knee joint, you are going to talk about. So, these 5 ligaments or rather 3 ligaments are important to it. See this one which is known here, ligamentum patelli, collateral ligament, right and left, we call them as medial collateral, lateral collateral, and the third set we call them as cruciate ligament which is present to it. We call them as anterior cruciate ligament, posterior cruciate ligament. These 3 sets of ligaments, these are the ligaments of the knee joint region. You have to prepare this particular knee joints ligaments for your exams for the knee joints. So, ACL, PCL and the injuries to them are very prone. So, like this collateral ligament and injuries to them are kind of like a vulnerable, and that leads to some kind of changes in the gaits and as well as this particular leads to disability. So, these ligaments in the upper end that you have to prepare in this particular bone whenever you are preparing it or reading this thing. Apart from that, we have this particular thing which is known as meniscus that you have to learn about it. So, this meniscus, and what do we mean by the meniscus? That is the end thing that we are going to talk about, this particular bone osteological part. So, this condyles, if you are looking this particular condyles from above, one is short and other is long. So, this is a superior view of the condyles, and this particular condyles and split into this particular eminence into anterior condylar space and posterior condylar space. So this particular condyles, if you are looking that particular above, which looks like this, so they are medial condyle and lateral condyle. This is the superior surface. That means you are looking from above, just like the way I am looking above side. So this superior margin you are looking at here. So this particular superior surface, in between this particular on these condyles, we have a cartilage disc placed in here. So this cartilage disc which is placed in here and here as well, which is missing in this particular bone because that is present in the living condition. So this particular cartilage disc which is present in this particular condyle superior surface, we call them as meniscus. So these are known as meniscus. So this particular meniscus present on the medial condyle superior surface, we call them as medial meniscus. This present on the lateral condyle, we call them as lateral meniscus. They are cartilage disc made of fibrous cartilage. Now just like fibrous cartilage, like any other cartilage has, this particular thing is present here is because of this, to avoid the frictions of the knee joint. So whenever bending and unbending this knee joint, we have this particular friction taking place. So to ease this particular movement, bone erosion between this cartilage bony articular end of this femur with this tibia, whenever you are bending and unbending it, to cover this we have this cartilage existing to it. It looks like semicircular or to this particular circular shape on this particular meniscus which is present. One is large, one is big, one have got like typical shape, other is having little different shape. Sickle shape, one is semicircular. But anyways, we are not going to talk about it. The concern over here is that this cartilage disc which is present, and this particular cartilage present on the superior surface. We ask this particular question, this particular about this meniscus, what is present on this particular top of the condyles or superior surface of the condyle. Many a times we do not recall this particular element which is present in here. But if you regard this particular knee joint, this is like the most important thing that is related to this anatomy or importance of this knee joint. So this particular meniscus is kind of like a cartilage disc which is present. If it gets damaged, we do not have any replacement for it. We have to just like throw it out. And if this particular cartilage is lost, we have this particular too much frictions going on, and then movement of the knee joint becomes too painful. Then we have to replace it with this particular artificial cartilage or artificial synthetic prosthesis, which commonly known as knee joint prosthetic surgery or knee replacement surgery. So knee replacement surgery is nothing but we replace this particular meniscus which is worn out, damaged, and replace it with this some kind of prosthesis inside and place it or cap it with this cartilage end with cartilage ends with this particular tibial side and as well as femur side. So this particular meniscus, medial and lateral, they are separate, they are not joined. So this particular meniscus, medial and the lateral one, they are related to this particular MCL and LCL, medial collateral ligament and lateral collateral ligament. They have an intrigued relationship between them and they are having a vulnerability, medial one and lateral one. Some of them are more prone to have injuries that we are going to learn in the practical class, theory classes on the knee joint. Whoever is going to take and going to discuss about it. Now this particular meniscus is made of cartilage which is present in here, fibrocartilage. Once it damaged, it cannot repair. So it is kind of irreparable, one time gift that we have. So if it is broken, damaged, worn out, it cannot repair. So if you are wasting this particular cartilage by some kind of injuries, either we have to just like live with this or you have to replace this. So this meniscus that we have to need to keep in mind whenever you are talking about this particular condyles, whenever you are studying this particular thing anatomically, about osteologically as well. So again, coming to this particular bone, starting with this particular anatomical side determinations, you have to determine this particular tibia belongs to right side or left side. Easy to identify upper end and lower end by the expanded upper end, lower end, which is little bit less expanded compared to the upper end. Then you have to identify this particular anterior and posterior based on tuberosity placed on the poking to the anterior side, and the posterior side we have this particular soleal line, also known as soleal ridge. And then you have to identify medial and lateral, which is easy to identify the medial and lateral based on these particular projections, the medial condyles, the medial malleolus. Medial malleolus also can be felt on the medial side of this particular side, which is subcutaneous. So you should be able to feel this particular bony points like this one, tibial tuberosity, so this malleolus as well, these landmarks you have to feel. Again, coming from this particular upper end, we have this narrow part which is known as shaft, which is present in here with these borders and surfaces, anterior border, interosseous border and the medial border it has, and it has got surfaces, posterior surface, interosseous surface or lateral surface, and medial surface or anteromedial surface. These are the things. Lower end have got like a surfaces like anterior surface, posterior surface, medial surface, lateral surface. Lateral surface on the lower end have got like a lower attachment point for the this particular fibula as well. So, fibula is attached on this lower end and this upper end, and in between them it is widened by a gap between. So, this particular gap is bridged by this particular membrane that we are talking about, interosseous membrane, also known as making a joint. We call them as syndesmosis. We prepare the syndesmosis for examination. Many places we have this particular similar kind of joint existing, upper limb, lower limb specially. So, this particular surfaces and borders and the projections that you have understood, and then you have to go for these particular features that is present on this region. Upper end have got like condyles, which is bony part between them, which is medial and lateral condyles, and then intercondylar area, which is split into anterior posterior part by the eminence. And this anterior part and the posterior part of this intercondylar area is for anchorage of this cruciate ligament. Anterior cruciate ligament attaches to the anterior intercondylar area, posterior intercondylar space attaches to the posterior cruciate ligament. These are the two important things that you keep in mind. Apart from that, superior surface lodges on these particular condyles. On top of these condyles, we have this particular bony cartilage disc, cartilage disc. We call this cartilage disc as meniscus or menisci, depending on singular or plural. There are two of them, medial and lateral meniscus, which is present in it, and fibrocartilage, which is present in it. And then this, we have this tuberosity, which is present on the anterior side. We have this particular anterior to this particular lateral condyle. We have the facet for the IT band attached, and this on medial condyle on the posterior or posterior lateral side. We have this particular groove for semimembranosus muscle or tendon to attach in here. So, going down from this region, we have this particular shaft, posterior surface of the shaft have got like this feature, we call them a soleal line. Above the attachment here is for popliteus. On the line we have the soleus. Below it is having got two split, medial side and lateral side. We have two muscle, like we have the flexor digitorum longus, which is attached, and the tibialis posterior, which is present on the sides as well. On the anterior side or this particular on the medial surface, above we have three muscles attached, that is roughness which is present for it, sartorius, gracilis and the semitendinosus, and below here we have the tibialis anterior, which is related to this particular muscle, it is attached on this side. And this particular inferior surface gives this particular under surface of this lower end, where this particular malleolus is having. This surface is for the making of this particular joint, which is known as ankle joint. You see, this is an ankle joint which is present in here, which is formed by this particular bone under to it. This is a bone, we call them as talus, T-A-L-U-S, talus. So, talus is the bone which is present under to it, which is looks like turtle back, and this particular talus on into which this particular bone is sitting on here. So, this part of the talus we call them as body of the talus or body of the superior surface of the talus, making a joint on here, we call them as this joint as ankle joint, which is present on the under surface to it. In this particular ankle joint, there are several kind of ligament which is present on the sides. We call them as deltoid ligament, spring ligament, oblique ligament, lateral ligaments, which are present and holding this. When you are going to study this particular joint as well, we are going to talk later on. Apart from that, this particular tibia takes place in few joint formation. This particular tibia on the superior side is joining with this femur, making this making this particular joint, we call them as ankle joint. Medial and lateral compartment is there. With this particular tibia, we have this fibula anchored to it, fibula with is making two kinds of joint, one above, one down and one in between. So, we call them as superior tibiofibular joint, inferior tibiofibular joint and the middle or interosseous tibiofibular joint. Three joints are there present in here. So, one above, three on the sides and one under, which is making in here is ankle joint. So, this particular joint, ankle joint, is making with this under surface of the tibia with this particular talus or superior surface of the body of the talus, making this joint. There are only major movement which is present on this talus is this kind of joint, which is known as dorsiflexion, plantar flexion. These are the two things which is present, or flexion extension kind of joint, hinge joint movement which is present on it. So, this is about the joint which is present to it. Remember about the ligaments, about this particular joint, upper end specially, we have this tibial tuberosity. On the tibial tuberosity, we have a ligament, we call them as the ligamentum patelli or patellar ligament. What is patellar ligament, what is quadriceps ligament, what is quadriceps muscle, how this particular things are anchoring, these are kind of important, and this patellar ligament have got clinical importance that you know about this knee arc reflex which is related to it. Other important related here is cruciate ligament, anterior cruciate, posterior cruciate, and this collateral ligament which are present on the side, right side, left side. We call them medial collateral ligament, lateral collateral ligament. These collateral ligaments have got intrigue relationship with the meniscus which is present on it. That particular relationship between this meniscus with this particular collateral ligament saves some of kind of like a saves or protects this particular protects this particular meniscus during some kind of movement that you are going to learn in this as well. So, these are the features about this particular bone has. See by yourself with this particular bones, right side, left sides, make sure you identify this right side properly with the left side separating it, identifying the features, and identify this particular joints which are present in the between this tibia with the fibula above and below in this region. And remember this particular bone we call them as patella, do not have any attachment whatsoever with this particular bone which is tibia. This particular bone is sitting on this particular front of the femur. So, this particular bone patella is making a joint with this lower end of the femur, not with any bony attachments or bony articulation is not there with this tibia with the tibia with this particular patella. So, remember that particular thing during examination, do not get confused. Alright. So, check by yourself, see that whether you can identify these particular features that is present on the bony parts of nerve. Make sure you identify these major points that we have discussed. Beyond that, there are several things are there in the books that you can just like learn as well, but these are the salient features that you must come prepared during examinations.